Welcome to the Spark Live webinar series, one component of our Spark Knowledge Mobilization program. Spark is Children's Healthcare Canada's shared platform for advocacy, research, and knowledge. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. Children's Healthcare Canada would like to thank our funding partners for their ongoing contributions that support all of our programs and activities, including this Spark Live bi-weekly webinar series. There are two options to join in on the live conversation. Questions and comments for our panel or presenters can be typed into the question box, or comments that you want to share with the audience can be typed into the chat box visible to all of our attendees. For those of you on Twitter, tag @ChildHealthCan on any webinar-related tweets or use the hashtag SparkLive. And to keep up to date on all of Children's Healthcare Canada's webinars and other activities, be sure to sign up for our weekly Spark News e-bulletin by visiting our website at childhealthcan.ca. Hello everyone, and welcome to another edition of Children's Healthcare Canada's Spark Live monthly webinar series. The Spark theme month for June is Child and Youth Mental Health. I'm Paula Robeson, your host for the next hour. Children's Healthcare Canada acknowledges that our offices, located in Ottawa, are on the unceded, unsurrendered territory of the Algonquin Anishinaabe people. We recognize and deeply appreciate their historic connection to this place, and we also recognize the contributions that Métis, Inuit, and other Indigenous peoples have made in shaping and strengthening this community, our province, and the country. We're delighted to speak today with Nikki Summers, Raissa Amany, and Vicki Cochrane to bring you Stemming the Tide, investing early in the mental health of Ontario's 7 to 12-year-olds. Before we begin, however, we'd like you to answer a few quick poll questions for us. Please note you'll have to answer all 3 questions to submit your response. While you're responding, and thanks so much for doing so, I'd like to introduce our speakers for today. Nikki Summers is the Manager of Knowledge Mobilization at the Knowledge Institute on Child and Youth Mental Health and Addictions, which is hosted by the Children's Hospital of Eastern Ontario. Nikki has long brought a passion for evaluation, engagement, and knowledge mobilization to her work, in roles both in research and community engagement. She primarily worked in and extensively studied in the area of mental health in children and youth, with a keen interest in the impacts of social support, such as family and friendships. At the Knowledge Institute, she's part of a team that creates and mobilizes a wide variety of knowledge products that are co-developed with agencies, government partners, young people, and families to advance evidence-informed mental health services within Ontario's child and youth serving sectors. Raissa Amany is currently pursuing an undergraduate degree in health sciences at the University of Ottawa, and she's a passionate about health equity, pediatric health, and youth engagement. Having personally seen how health inequity affects marginalized populations, Raissa continues to advocate for improving accessibility and youth engagement within the healthcare sector. She's a Youth Advisory Council member with the Knowledge Institute and Kids Help Phone, and a research partner with CAMH, and a groundbreaker with Frame. She's also the co-executive director of the Young Canadians Roundtable on Health. Vicki Cochrane is a busy mom of 2 sons with exceptions that require constant advocacy, resourcefulness, and the ability to ask for support when needed. She's driven by a strong desire to bring the voice of families to trying to navigate child and youth mental health with the hope of improving the system. Vicki's also a child and youth worker with over 20 years of experience working with the Children's Aid Society. And for the past 6 years, she's provided peer support to other parents with lived experience through Parents for Children's Mental Health, a provincial peer support program through Children's Mental Health Ontario. During this presentation, we welcome you to share your reflections in and connect with others on the line via the chat box, and type any questions you have in the Q&A box, which we'll pose at the end of the webinar. It's now my pleasure to pass the mic to Nikki.
Thank you. Thank you for the opportunity to join you today virtually. And I appreciate being surrounded by those who are really devoting their time and effort to supporting those families and children who really need it most. It's so wonderful to have the opportunity to work with Vicki and Raissa and share the findings, recommendations, and work that we're doing to really invest in the mental health of Ontario's 7 to 12-year-olds. It's important that we begin this discussion with our commitment to reconciliation and start by acknowledging that there are long-standing health and well-being practices used by Indigenous nations across Ontario that existed well before settler health and mental health care institutions were created and continue to be used today. It's also important that we acknowledge that colonial health systems have been and do continue to be spaces where Indigenous people and communities experience discrimination and harm. There's much for non-Indigenous people working in the health sector to learn and change to be in better relation to Indigenous communities and families. For those of us who are settlers, we must continue to commit and take action to prioritizing and learning more about how we can uphold the conditions of the treaties that govern this land. I want to share a little bit about myself and the organization that Vicki, Raissa, and I support. My name is Nikki Summers, and I'm the manager of Knowledge Mobilization here at the Knowledge Institute in Child, Youth, Mental Health, and Addictions. And we're a provincially funded program in a department of CHEO, the Children's Hospital of Eastern Ontario, here in Ottawa. We've been around since about 2004, and we work with the Child, Youth, Mental Health, and Addictions agencies and sector as a unique intermediary organization that builds connections, shares knowledge, and draws on expertise to strengthen Ontario's mental health programs and services for children, young people, and families. Our organization is driven by a number of advisory councils, including our Youth and Family Advisory. Our family and youth advisories reflect our commitment to meaningful engagement. We rely on family members and young people's integral input, expertise, and guidance to ensure our policies, approaches, and initiatives and other works and projects are responsive to the evolving needs of families and young people. We are all working together to drive high-quality care and aim to support the best mental health and well-being for every child and young person here in Ontario. Child and youth mental health and addiction system is quite complex. And as you know firsthand, it's made up of many care providers and organizations from different sectors. And this looks different across our country and across our provinces. We're all focused on ensuring that children and young people have the right mental health supports at the right time. The system also includes networks and care pathways that connect from various providers and care settings, as well as government and other institutions that set policies and provide funding and other resources. In my role, I work within one of our four key strategic directions, which is knowledge mobilization. I support various projects that involve conducting new research, synthesizing and sharing evidence, and providing coaching and resources to help transform knowledge into action. This includes our policy papers, like the one we're here to share with you today, which contain recommendations that are grounded in the latest evidence on a particular topic. And those prepared more recently have really resulted in on-the-ground changes to the way mental health service is delivered, planned, and evaluated. We focus on a lifespan approach and highlight the importance of this, as every age range has unique developmental needs and strengths. For example, my 2-year-old is very different needs and considerations than my 5-year-old, which looks completely different than my 18-year-old nephew. And we need to address their needs and leverage their strengths at each developmental stage. Healthy social and emotional development begins in the early years, from birth through age 6, and this is the essential building block for good mental health throughout life. We know that early identification and intervention can save families a lot of stress and strain, and since responding early can often stop challenges from becoming more complex or crisis. Investing early also gives government, taxpayers significant resources over time. So early intervention and return on investment doesn't stop at the age of 6. The middle years, from about 7 to 12, is a period of major developmental change, and still early enough that timely interventions can have an enormous impact on lifelong mental health and well-being. We're excited to join you today, not only to share our recent policy paper and findings, but to learn from you, those that are working day in and day out with young people and families, passionately supporting them. We need to hear from you on what innovative work is happening across our country, what challenges are most prominent right now, and how together we can leverage the strengths of our communities and our organizations to better inform the mental health systems for those who are ages 7 to 12. Today we'll share with you why the middle years are such an important developmental period. We'll discuss the formation of this paper, the key teams who co-developed it, and we'll describe the purpose and scope of this work. We'll discuss the importance and the value of family and youth engagement in policy work and share our evidence-based recommendations. And then we'll come together and discuss next steps involved in mobilizing this paper and actioning the recommendations within this paper. Why the middle years? Despite the many strengths of our mental health system, we know that there are many challenges as well. The reason we started this work is because despite the many strengths, like connected care, many service providers, we know that there is a lot of work to be done in addressing long wait times, barriers to care, numerous barriers, and families also experiencing navigation issues, accessing proper care at the appropriate time. And there's a lack of integrated services and a lack of culturally appropriate services. We know that the middle years can be an integral time to address this. The middle years represent the second stage in early human development between the early years and adolescence. And during this time, children's brains, bodies, and social and inner worlds change rapidly and significantly. It is a unique and critical developmental period which children's personalities and behaviors and tasks are formed. During the middle years, children develop increased emotional and cognitive capacity, which allows them to form more intimate friendships and social relationships. This is where the foundation is established and a key time to have appropriate supports in place for optimal development. We know that with an increasing number of mental health problems emerge during the middle years, and research shows that up to 35% of mental health problems have their onset before the age of 14. The good news is that if these issues are addressed early, they can be prevented from worsening later in teen and adult years. This presents an excellent opportunity to minimize risk factors and really maximize those protective factors such as family wellness, supportive school environment, positive peer relationships, and social emotional learning. The findings of this paper were shaped by experts in the area, including Raissa and Vicki. I want to invite them both to share today why they joined the Youth and Family Advisory Councils here at the Knowledge Institute and what sparked their interest in mental health during the middle years. Why do you think mental health is so important during this developmental stage?
Good morning, and thanks for having me. I'm happy to be here and wanted to share why the middle years was so important to me. As a child and youth worker, as it was mentioned, I've worked with the local Children's Aid Society for over 20 years. And then at some point during that time, I became a parent of a child with mental health challenges, and it was a whole new experience. I found that despite my skills and training, there were a lot of times where I didn't know what to do, and I felt powerless and ashamed that I didn't know what to do. And at that time, I thought to myself, if I have this full toolbox as a child and youth worker, imagine how families are feeling that don't have my experience. And I was at the same time supporting many of those families as well. So I was searching for a space for advocacy, and I had at some point signed up for a newsletter for what used to be called the Ontario Centre of Excellence for Child and Youth Mental Health, now known as the Knowledge Institute on Child and Youth Mental Health and Addictions. At that time, they were recruiting a family member for their strategic advisory council. So I applied, took a shot, and I was accepted. And ever since, that was around 2017, I've been involved in a number of activities there. The Knowledge Institute is a space where I found I could share my lived experience and actually have an impact by being an active decision maker in a number of projects that were underway for improving the system of mental health care. And I brought with me the voices of other families that I was hearing through my work as a child and youth worker at Children's Aid Society and as a peer supporter through PCMH, which is Parents for Children's Mental Health. So I may not always know how to manage my own son's needs, but I do know what my family needs, and I hear what other families have identified as needs, and that the family voice certainly matters. So being on the Strategic Advisory Council was a really empowering experience and led to other opportunities, like currently being a member of the Family Advisory Council and building peer support networks for parents and caregivers through organizations like Parents for Children's Mental Health.
Raissa.
Yeah, thank you. I'm so very honored to be here to kind of share a little bit more about why I'm passionate about the middle years. But like Vicki, I worked a lot during my high school years on a micro level doing grassroots level mental health advocacy. And I did find a lot of the struggles that I went through was there's always this macro system that I could not make an impact. And I, wanted to dip my toes as well in policy related work, but and also working in the provincial national system, And so I found an opportunity through the prior name, the Ontario Centre for Excellence for Child and Youth Mental Health, and I applied and got in. And I really felt that the team was really passionate about actually including youth voices in projects such as quality improvement in services and creating policy paper like this. In terms of the middle years, that I actually started having experiencing mental health challenges during this late time. And it was really difficult for myself personally, as I came from a culture where mental health was very stigmatized. And primary care did not actually look out for me at that time, that, even though I was showing symptoms of those mental health issues, they weren't really akin to it, and like they didn't really pick it up. So that's why I kind of come back to this project from my own personal experience, so that, others, so we can do better for our future middle years population.
Thank you, Vicki and Raissa, for starting us off and sharing your experiences, and not only your experiences, but the important perspective, integral input, and the work that you do with us here at the Knowledge Institute. We spoke a little bit about some of the issues with our system of care for mental health, and we've heard from families and service providers that we experience ongoing navigation issues, access to care, lack of integrated services. And this is an important discussion that couldn't take place without the insights and experience and expertise from parents and families. A system is not a system if it's not working for those that we're supporting. Raissa, could you share a bit more with us about the insights on the main challenges of the mental health system for children in the middle years, how it's changed over the last few years, especially given the pandemic that we faced?
Yeah, absolutely. I think reflecting back on my own experiences, going through that middle years and growing out of that middle years, I think the challenges do still the same, of having that long wait times for services, and having a lack of culturally inclusive services. And I think this has been exacerbated by COVID, just because now I'm a caregiver of a sibling who's going through mental health challenges in that middle years. And I see the trouble and the lengths of my parents needing, like, asking for services, and then ended up just having a long wait time, being like, here you go, see you in 6 months, right? And I think it's disheartening as someone, who has been in that space, to see it again and again with my siblings, right, who are going through that mental health challenges. Um, and so I think, again, with the culturally inclusive services and the long wait times for care, there are a lot of actually barriers that, as myself, I'm very privileged that I'm a middle class family, and, we can access private services. But if I were to put myself in the shoes of my friends who also have, who is also a caregiver to an individual or a sibling who is going through mental challenges during the middle years, I just can't imagine, like, the challenges that they will face.
Thank you, Raissa. That's really powerful, and it really highlights what's happening right now in this moment. And I know service providers feel that as well, with the influx of extreme and critical issues that are coming in, and that we see the rise in mental health problems right now. Vicki, did you want to share as well?
Sure, thanks, Nikki. And Raissa, you raised so many good points, even from a parent's perspective, that I can absolutely empathize with. In the middle years is really a time where kids are entering elementary school, and they're moving through and building their friendships and families at the same time. The parents are often making connections and building their support network as well during this time. And a lot of times it's kids like my son who were really isolated actually during elementary school. And that isolation actually just created further issues into adolescence. And so it's a really crucial time to be intervening and supporting families. Parents are often impacted by having to miss work during these years because they need to care for their child who can't be home alone, and those sorts of things. So there's an economic impact. And I think that when we're looking at the challenges through the pandemic, it exacerbated all of those things. So families who were already isolated became even more isolated. Parents who were missing work, certainly with kids not being in school, were missing even more work and potentially even losing employment at that point. And so the impact in the middle years is significant on the whole family, not just the child that's in need of services. And so what families families often find is there's a lack of collaboration amongst sectors in this time. You know, you're maybe getting healthcare from your family physician who doesn't really know what maybe mental health supports are out there, and then you don't really know where to start as a parent. So system navigation is a challenge, and these are the things that just lead families to just staying isolated and not seeking the help that they might need. My anecdotal observation working in the child welfare system is that since the pandemic, there are a lot more families and youth entering the child welfare system after having not received mental health supports through the middle years. So we're seeing lots of adolescents in need of significant support now, as well as the middle years children coming to hospital, and suicidal ideation or attempts have been on the rise. And so these are some of the things as a family member, as a parent, we're sort of supporting families with in the communities. And it has definitely exacerbated what was already a problem previously.
Thank you, Vicki. And I know that resonates with those that are here in the room with us today. And the things that we are seeing as families and youth are reaching out for support and the level of supports that are required at this time. And this is exactly why we dived in and recognized this as a priority to really begin to understand the mental health strengths and challenges of those that are 7 to 12 years old, how we can really leverage this and work with families and young people. And the second was to provide concrete evidence-based recommendations to help leaders and government and service delivery organizations in supporting these unique needs of the children that are in the middle years. How we went about this was the development of this policy paper was driven by two teams, a core project team and an advisory committee. Our team was a small group of people from the Knowledge Institute and a consulting firm with Optimus SBR. The core team is responsible for managing project and leading the literature review and stakeholder engagement activities and writing of the report. But our advisory committee was critical and included direct service providers, agency leaders, family members, young people, academics, and policy advisors. The committee provided guidance and feedback on the project and to help us identify and solidify which recommendations we wanted to put forward that were based in evidence. The advisory committee for this paper was integral to its in development, and our advisory councils were an integral part of this, including Vicki and Raissa. So before we dive into the results of the paper and the recommendations, let's take some time to understand the important and the impact of our family and youth engagement in our policy work here at the Knowledge Institute, and to drive some learnings and some strategies for how you could implement this into your work moving forward as well. Raissa.
Thanks, Nikki. So I think I'd like to start with the fact that, you know, policies for children and for youth are always created without having children on board. Right? If you imagine a table, right, full of policymakers, you probably don't see children and youth, and they always remain almost invisible. And they are actually critical members of the decision table whenever you're creating policies. And when we bring youth engagement in, especially within the child and youth mental health system, it can actually really improve the sector in many ways. And one of them is through lived expertise. So as you can see, with lived expertise, it can actually create decision-making more effective and build greater trust within the institution itself. By letting, for example, children and youth to kind of share about their lived expertise, but also through that lived expertise, you can learn more about their different priorities and also what the needs are, right, at that level. And I love the 5 words about nothing about us without us. It's a phrase, right? That it's an idea that we say that no policy should be decided by any representative without the full and direct participation of members of the group that are affected by that policy. So policies that in fact that affect young people should really have youth input, right? As much as you can make an educated guess in terms of what the community needs, what that population wants and needs are, but you can't really assume what they want, because there's a lot of nuances, especially within subpopulations and even age groups, right? When we're talking about the middle years versus talking about the older young adults, right? So I think it's really, really critical as much as we can to really include children and youth whenever possible.
Thank you, Raissa. Vicki.
Thanks, Nikki. Great job, Raissa. So many good points. And I just want to go over this slide kind of and add some personal anecdotes here because families really are partners with a valuable perspective. And I share that because often families who advocate or speak up or maybe go through a complaint procedure are always labeled as that parent, you know? And when I first started out advocating for my own son and advocating also for kids in the system that I work within, that parent is really a hard stigma to battle. Even as a trained professional in my own community, as a parent of a son with needs, I suddenly became that parent, and that is a really difficult stigma to swallow as someone who believes in advocacy, sees the power of it, and knows that it can be helpful. My perspective is it matters. My skill level in communication might be different than another parent who maybe is trying to advocate and communicate what their needs are, but the message is still the same. Family voice matters, and that's why families should be seen as partners. Family engagement is an essential tool for system improvement and quality care. And the reason for that is if you're dealing with that parent, if you truly listen, they might not be communicating, in a really articulate way, but there's something in their message and it's valuable. And try to listen to beyond the emotion you might be seeing and try to help them articulate what the specific details of their needs are. I can tell you there will be something in there to work with to improve system care or improve service experience. In my experience, having the Family Advisory Council has also created a number of opportunities for partnership with families at all levels of planning. In my own experience, I've had a lot of opportunities as a family advisor, such as evaluating proposals for system improvement in the Knowledge Institute's Innovation Initiative, which actually just got released today. Some grants are being given out to programs. I had a voice, had a spot at the table to be able to actually look at the proposals, think of them from the family perspective and the impact that it will have on families, and really had an equal partnership opportunity in deciding where the grants should go. I also participated in co-developing the quality standards for family engagement with the lead agency consortium. And I believe Mamta Chai is here today. We worked together on that with a number of other excellent people. And this was an opportunity where family and youth sat at the table with executive directors, and we were all equal partners in collaborating on improvements for how to engage families effectively, listening to each other, talking it through, setting the bar for what it should look like. I also had the opportunity to facilitate in gathering the family voice through focus groups throughout Northern Ontario for the Youth Wellness Hubs of Ontario. I sat at tables and facilitated conversations with family members around what they needed. And as many of you who are here may know, Northern Ontario definitely needs support and needs more access to supports. And that was really enlightening for me to hear about that, living in Southwestern Ontario, which happens to sometimes be resource rich. We need to know about the North. So those are just a few examples of how there's opportunities to listen to families. And the family engagement really has become integrated into the child and youth mental health and addiction services through projects and policy development like this paper and like the quality standards, which are now actively becoming a part of our system in Ontario. So just remember that that parent has a lot to offer, and we can really help reduce that stigma.
Incredible examples of not only how far we've come in our sector with engaging meaningfully with family and youth and how to really utilize their expertise, but also your own experiences and how valuable it is to be a part of the work in a way that is truly meaningful and impactful. So I'm wondering if you wanted to share a bit of insight on how organizations, those on the call, researchers or policymakers can begin thinking about stepping into a space where they're equipped with the tools and knowledge to really meaningfully engage with family and young people. As you had already mentioned, we do have our quality standards for family engagement and youth engagement available on our website, which I've dropped in the chat here as well, but a great place to start thinking about it. But Vicki or Raissa, did you want to share some thoughts around this?
I can start the conversation. I think in this case, right, what I really recommend folks, whoever asks me for advice, especially like, how do I create a youth council, right? How do I create a youth engagement piece? But what I really ask folks to really reflect about is, would this be an organizational mandate or would this be just a one-off thing? Because what I really appreciate with the Knowledge Institute, but with a lot of other folks that I work with that really truly takes youth engagement to heart, is that it's an organizational mandate from the leadership and down, right? So it's not just like a one-off department or a one-off project. And I think that's what's the first thing I always say. I think the second thing too is not to scare folks, but youth engagement can be labor. It can be a lot of labor, and it's labor of love. And you're gonna have to think about kind of, your organization's capacity to truly engage youth in non-tokenistic manner. And when I bring about non-tokenistic things, is I always refer back to like the theories of youth engagement, and specifically called the Hart's Ladder of Youth Engagement. And in this ladder, it's online, you can search it up. It shows kind of different levels of the ways you engage youth. And we always strive for youth adult co-creation or co-partnership, right? And sorry, youth adult co-creation, and then like youth-led creation, sorry. But I always recommend folks to kind of think about those two pieces. And then looking through the paper, the quality standard, and also kind of the toolkit that Nikki just dropped into the chat, where there's a lot of good pearls in terms of starting your youth engagement pieces.
Thank you.
Thanks, Raissa. I could jump in here, Nikki, too. You covered a lot of good points, Raissa, especially that leadership must buy in. And if leadership isn't bought into valuing family and youth voice as a partner, then it really will sort of fall on the tokenistic end of the Hart's Ladder. And it's really, Hart's Ladder is a great tool to look at. And I would absolutely agree with that. And I think another place to start is to really identify family members who are involved with your organization, maybe receiving services or having had received services, who might be considered that parent. Maybe give them the opportunity to come to the table and kind of share their expertise around what they experienced. I know that the Family Advisory Council at the Knowledge Institute, we really have become partners because we've participated in developing tools and strategies that we're happy to share, such as the quality standards for family engagement. We also, as a council, we've developed terms of reference. We've developed recruitment strategies, which, by the way, we tapped into the youth recruitment strategies. Raissa, thank you guys very much for everything you had already done, because why recreate the wheel, right? If it's already moving and in motion, let's share resources and get things going. We've also developed orientation processes, as well as evaluation and exit processes. So when someone leaves the council, what did they think, right? What would they want to see, look different? And it's also important to consider where the parent is on their journey in supporting their child or youth, because sometimes they might want to jump in, but aren't really able to commit the time or have to step in and out. So I encourage you to be flexible and understand the needs of that family at the time, but still see them as a valued partner. So they might not be able to sit at the Family Advisory Council table, but they might actually participate in a focus group or help develop a survey, or be on your board of directors, which only meets on occasion. When we're talking about family partnership and family engagement, we're talking at all levels of your organization. So here, I know in London, which is where I'm from, our mental health agency, our lead mental health agency, Vanier, has a family voice on the board of directors. So again, something to consider. Very important. Thank you.
Thank you, Vicki and Raissa. The expertise on the line is so glaring clear, and I really appreciate having both of you here with me today. And I want to just offer that if there are questions or opportunities for you, the participants, to jump in with ideas on how you're going to begin your journey, or if you have questions about where our resources are or would like to connect with us, please feel free to do so in the chat, and we're happy to share our contact information as well. I'm going to dive right into how we began our journey with this paper after we really prioritized this as an area of focus. So we conducted a literature review focusing on online peer-reviewed journals, as well as gray and white literature. We place particular emphasis on articles that were published on the onset of the COVID-19 pandemic, really looking at our current context. We also held a number of key stakeholder consultations, and we conducted 8 interviews and 10 focus groups with a total of 82 participants. Our participants included clinical and agency leaders, educators, direct service providers, academics, policymakers, parents, and young people whose mental health journey began in the middle years. The purpose of the consultations were to gather evidence and understand the current state of the mental health system for those 7 to 12 years old, the strengths of the current system and the challenges, and all of this was to inform our recommendations. We found then confirmed that growth and change and development is really rapid at this age. We also know that there's a great strength in our system, right now. We have a lot that we can leverage. There's excellent collaboration across our sectors, excellent collaboration across organizations that are supporting child and youth mental health. Another key strength of the system is that it's committed, it's creative, and it's passionate workforce. Those that are on the ground doing the job are there because they care. Through the pandemic, it has become obvious that the sector can pivot and adapt quickly to the emerging needs of children and families and the changes in our environment. Virtual care took off, and it was leveraged across the sector to meet the continued needs and supports throughout the lockdown period and the increased access needs to services. And this was sustained even with the return to in-person care. We also know that despite some of these strengths that we can really leverage, there are some challenges in Ontario's mental health and addiction sector. These are related to the system resources and capacity, access and navigation issues, service and design and delivery and policy. We're experiencing a human resource crisis, which I know is felt strongly across the group today. There continue to be barriers to access and navigation issues for families, as well as service providers, and poor service integration and coordination. Wait times are long, and the availability of service varies between rural and urban settings. And we know, especially in Ontario, that the northern communities face a serious crisis. Mental health and addiction services tend to be designated and delivered using a Eurocentric approach. And for this reason, services are not often culturally relevant for much of Ontario's diverse population. Additionally, there's no comprehensive population mental health data strategy here in Ontario. Decisions related to assessment and treatment approaches are made by service and agency leaders and are not driven by policy decisions. So without such a strategy, evidence-based approaches to mental health planning and delivery cannot happen. A main challenge that we've heard and seen time and time again is that services and sectors and funding are really siloed, which increases or exacerbates barriers to care. So I'd like to ask if there are any additional insights or anything you'd like to share on the importance of cross-sectoral collaboration of mental health services for our young children here in Ontario or Canada-wide, and how the integration of family and youth voices could strengthen the system of care. Raissa or Vicki?
Thank you. All right, Vicki, go ahead. Thanks. So I think from my end, right, I think I've seen where youth voices are really integrated. I think I've seen it, improvements are going quicker, not necessarily quicker in a say, but I think it really reflects the needs, right, of what the youth needs are, right? And not like we can only, like what I've said again, like you can only guess so much as to what they need. And if we just take the time to, recruit potentially past clients or have community members as integral parts of your board or your evaluation piece or your your strategic advisory board, right? I think it will just really reflect back into what the population needs and not what we can guess. And so that's what I always like to say.
Absolutely agree, Raissa. Vicki?
Thanks, Raissa. I echo that from the parent perspective. Nothing for us without us. Have us in at the table at every level. Having us as true partners really does help lead to reduced stigma surrounding mental health, which really could increase willingness to access services as well and foster a culture of mental health awareness and acceptance. If you hear from a parent, my child never gets invited to birthday parties, or they don't seem to have any friends, but when I talk to the school, they say they say they're hanging around kids. From my own personal experience, my son was isolated right from the beginning, and teachers' observations, because their time and abilities are so limited sometimes, they saw him always around kids. But at home, what I was hearing is he would stand next to a group of kids and wait for them to talk to him and hope that they would be nice. And then he'd try another group the next day and the next day. And that's how he went through elementary school. And as a parent, I ended up being isolated. I would try to set up those birthday parties. We would invite all the kids, but it was never reciprocated. And from my perspective, thankfully, I had a friend group that was a huge support network that accepted my son and his challenges and, helped my family through those times. But there are a lot of families and parents out there that don't have those support networks. So when you hear a parent talking about their child's isolation, take a look at their system of care and their system of support and look at how you can connect them with support. And, whole family care is super important. Again, I mentioned that because that's something that is often missing. The parent needs support, the siblings need support. Sometimes if there's a grandparent who's a caregiver in that scenario, they might need to be at the table as well. So connect parents with peer support, please. Look for organizations like PCMH, Parents for Children's Mental Health, so that they are not doing this alone. As I shared, I felt a lot of shame that I had a full toolbox and I couldn't do what my son needed. At least that's how I felt. It turned out accessing services, I was doing everything I possibly could. But what I found in doing this at work in advocacy was I found, okay, I do know something. I can help others. I can sort of have a voice at the table and not feel ashamed. And becoming involved in the Knowledge Institute really did help me be able to speak openly about my own family story. So there's lots of opportunities to bring the family voice to the table and help.
Leveraging that circle of care is so important during this age. And we know, and we've heard loudly, that timely intervention in the middle years can really make a big difference and have long-term positive impacts on future mental health and wellness for not only the child, but the family. It's essential that children and families are supported so that they can really thrive, and that we intervene before issues become more complex or more critical and more costly. So together with our advisory committee, including Raissa and Vicki, we developed 7 recommendations to attend to the mental health needs of those in the middle years and the challenges that we see in our sector. Our recommendations were rooted in the following principles. They have an emphasis on a whole government approach to care where responsibilities and accountabilities are not fragmented and not siloed. Engagement with children and families is absolutely essential to ensure relevant, appropriate care at the right time. The system is not working if it does not meet their needs. Across all of our work, we must start with and have a focus on equity. This policy paper was written in the depth of the pandemic, and mental health issues among children and young people were on the rise before COVID-19 arrived in March 2020, and the onset of the pandemic across the province contributed further to this increase. So of course, our first recommendation really started with a focus on pandemic recovery. Most children were negatively affected, with an early evidence indicating mass learning loss and an increase in mental health challenges. Community-based mental health and addictions organizations, along with partners and schools, should ensure that programs and services are evidence-based, providing social, emotional opportunities for children that will strengthen both their relational and individual protective factors. We need a whole government approach to pandemic recovery and should include a strategy to combat the loss of social emotional skills, the increased use of screens, and overall learning loss. We know that children in the middle years have developed an over-reliance on screens and social media during the pandemic. So to help families and schools monitor and curb screen use, the government should develop and share evidence-based guidelines to inform safe screen use going forward. We're beginning our work on this year at the Knowledge Institute, and we'll be developing a number of resources that will share the most up-to-date evidence on problematic technology use and examine the link to mental health and well-being, and develop key considerations for various age ranges, marginalized children and youth, and co-develop resources with family and young people to speak to the ongoing challenges and strategies for mitigating these risks. We know several studies have found and showcased that approaches to children's mental health challenges, particularly during the middle years, are most effective when the treatment involves parents, caregivers, and siblings, as opposed to children alone, really emphasizing what Vicki spoke to as the whole family approach. Children are highly influenced by their home and caregiver environment and their social supports. Family-focused approaches are more expensive than individual treatment, but they serve many people and often involve many sector partners to coordinate and collaborate supports across family members. But we know child mental health wellness goes hand in hand with family wellness. We know that this is a challenge because funding allocations might be a barrier for community organizations as they're based on the number of children served and often include a siloed approach. These numbers don't often include the focus on families or caregivers or siblings receiving care. Similarly, care models are traditionally centered around individual child and adults and don't take a holistic or lifespan approach. We call on the government to ensure funding decisions support culturally appropriate and family-centered service delivery and program. And this will bolster our ability for community mental health organizations serving children in the middle years to adopt and invest in culturally appropriate family-centered models of care that incorporate a whole family treatment. As a starting point, as we've mentioned, we can start with our family engagement principles outlined in the quality standards for family engagement to ensure consistent practices and processes are used across the sector. Ontario also needs a representative mental health data strategy that's developed with key partners across government and community-based organizations. Ministries should create the structure to support population health strategy planning and implementation. These data strategies should encompass both client experience data and system level data, as well as common data management strategies and mechanisms. We also have heard and seen that clear, efficient care pathways for mental health ensures that families and young people receive care at the right time in the right manner that is most appropriate for their needs. Schools, community-based organizations, primary care, hospitals, recreation, and other relevant partners should be a part of a broader strategy that ensures children in the middle years receive timely and appropriate supports. Government should use a holistic lens to ensuring funding and services are coordinated between sectors to reduce silos and barriers to care. We have also spoken about the importance of culture, and we know children's connection to culture, community, and identity are important aspects of developing a sense of belonging. However, not all care approaches and services are aligned with cultural considerations. This really reduces the likelihood of many families reaching out for care or getting the right supports they need. Organizations providing mental health and addiction services should employ evidence-based and culturally diverse approaches to care. Government should support this by ensuring diverse groups are involved in co-developing the population mental health strategy and roadmap, as well as related policies and programs, always beginning with an EDI lens from the start. Before the COVID-19 pandemic, there were calls from the government to build more capacity in children's mental health and addiction system by increasing investment in our human resources. And there's currently a very troubling staffing crisis, which we're experiencing, and this directly impacts children in the middle years. The shortage of staff is worsening the already high wait times and impacting the quality and the continuity of services that families are receiving. We must respond to this through policy and funding. In the long term, the government should include a focus on human health resource capacity building. The system also can pivot and begin to use more innovative care approaches that can be scaled up. That is, approaches that can reach more people with fewer or the same human or financial resources. So this could be group modalities, services and treatments provided by interdisciplinary staff, self-serve options, or virtual modalities. These can, again, use fewer or the same human or financial resources, but be span broadly across sectors or across communities. This could also help the deficit of services that are being provided in more rural populations. This is a quick roundup of the evidence-based recommendations that we have in our paper, and I've dropped the link in the chat if you want to read further, or please drop any questions or comments in the chat. But I'd like to again welcome Vicki or Raissa to share any additional thoughts or insights on the discussion that we've had so far. Otherwise, we can jump right into the big question of what now? Where are we going now, and how do we begin this work? Raissa or Vicki, any additional thoughts or questions before we dive in? I see a thumbs up. I love a thumbs up. This paper was really foundational for spearheading our work or beginning our work with a focus on the middle years, and it's just the beginning. We're really directing our efforts on mobilizing the findings and engaging with key partners such as yourself, and advocating for the need for additional funding and policy to address these key recommendations. So, as you've heard throughout this work, the message was so loud and clear. We need increased communication and transparency between sectors, and this is imperative for addressing the needs of children and family. And this work really starts by putting families first. We must support families in supporting their young children. The current system of supports for families is really fractured. We've felt this, we've heard this, and we're not always aware of the specific services within our own communities or the navigation between services. And this is very hard on not only service providers, but families and young people. The Knowledge Institute is continuing our work with the child and youth mental health sector here in Ontario to ensure meaningful engagement with families and young people to strengthen the supports, especially for those 7 to 12 years old. We're developing additional resources to share the latest evidence on culturally responsive approaches to care, and we're continuing our work in promoting a whole of government approach to care to ensure seamless service delivery. Our website and resource hub can give you access to a bunch of different resources and evidence to support your work as you begin your journey in this area as well. And we'd love to use the remainder of the time to hear from you, the participants in the room, and learn about how we can continue to mobilize not only the paper and its findings, but we want to better understand the challenges faced in your community across Canada or your agency with respect to serving children and their families 7 to 12, and hear about your key priorities. I'd love to open it up and see if there's any questions that are coming through our Q&A from Paula, but also hear from you. If there's anything that you want to share from your community, or if you're aware of any work across the sectors that are good examples of projects or practices that are really supporting those in the middle years, or some of the challenges that you're facing right now in your agency or organization in respect to serving families and children in the middle years.
Thank you, Nikki, Vicki, and Raissa. We do have a couple of questions that have come in. Before I get to those, however, Jose is going to launch another poll. You'll need to select an answer for all 5 in order to submit your responses. And while you're doing that, I will jump in with a question from Mamta. She's wondering if there are any recommendations around stigma. She says she looks at equity and culturally responsive services. There's a lot of data that states that in certain cultures, we're not seeing young people until they're presenting with very acute profile because of stigma and preventing them from accessing. Did you find or have any recommendations about how to get certain populations of kids to treatment from a stigma reduction point of view?
Vicki and Raissa, I can jump in first if you'd like.
Yeah.
The first thing that comes to mind is really that underlying theme of cross-sectoral collaboration, because we know that although we're seeing them maybe in our sector and our organization at a point of crisis or acute care, these concerns may have been raised in other community organizations or connections or circle of care that they connect with earlier. And that means that we need to reach outside of our sector. That means we need to be collaborating with other community organizations that are supporting those that may be more marginalized or may not have the same access to care that others do. We also know that this is a big challenge for rural communities who don't have easy access to supports, that might be driving 2 hours away to reach a community mental health organization, that might not be having access to virtual care options because of connection issues. And that means we need to make greater investment and greater attempts at identifying this. And this can come down to our data strategy as well, to better understand what are the needs of our unique community and knowing who's out there and what their needs are and how best they can have their needs met. Vicki?
Yes, I was just actually going to share from a peer support perspective that this is an area that PCMH is currently working on. And so far what we've learned is that certain cultures specifically, for example, we need to use different language than we might be using in our typical mental health work. And we really need to start at the basics and talk about kind of what people are experiencing in their home or what parents are living with, sort of seeing in their children, and be able to create a space that's safe for them to talk about what they're noticing, as well as creating a space for parents to just talk with each other about it, and really make it an invitation to the different cultures, along with the community organizations that are supporting them, such as the Swiss workers in schools, for example. They're often faced with that and can be helpful.
I'll just chime in a little bit. I think just building on the two things Nikki and what you, Vicki, have said, I think relationships are really important, especially in these cases, right? Especially if we are, you know, trying to get communities to, you know, show that it's okay to reach out. You know, relationships really matter. And I think too, part of it is meeting where they're at. And, you know, that could be, again, what Nikki have said, it could be outside of our sector.
Thank you. There's another question in there. Kathleen asks, can you give some small youth engagement strategies that can be implemented in a community that has very little current mental health support?
That's a question for me for sure. So I could start. I think I'm not familiar as to what your organization does, so I can't give a, you know, a very specific tips that may be really helpful to you. But just going off the top of my head, I think just having them involved in your strategic meetings, or, you know, if you are doing a program evaluation, for example, have them be in there, right? Have them be involved in from the beginning to the end. You know, it's really difficult. Like, I can't really give good tips per se that may work for you, because I don't know what you do. But again, just invite them and see what happens. That's my first advice.
Thank you, Raissa. I am not seeing any additional questions having come in. Do you have any for the audience before we wrap up?
I'd love to hear any examples. I know it's come up already of what we can suggest that is being done in terms of meaningful youth and family engagement. But if anybody wants to drop in the chat what they are doing right now in their organization, and examples that are in your community or across Canada that's happening and working well, so we can continue to really leverage and mobilize practices that are here in our country.
While folks are typing away, I will say thank you so much for this really great discussion and presentation. I want to say that this is part of the end of the time together, and we want to thank you so much for your time and expertise, and for those of you who have taken some time out of your day to join in. We know you're all busy, and we hope you depart with some practical knowledge to bring back to your organization. I can see in the comments that people are very grateful for the resources and for this discussion. So I anticipate a fair bit of interest there. Upcoming in Spark on June 19th, we're excited to bring you another webinar, Children's Mental Health, Research Messages for Informing Policy. This will be with Christine Schwartz, who's adjunct professor at the Children's Health Policy Center. On June 21st, we have our third webinar of the month, Child and Youth Mental Health, Parental Concerns about Children's Learning, Development, and Mental Health with Caitlin Bryant. And on June 28th, we're excited to bring you another webinar, Collaborative Pathways to Engage Healthcare Professionals in Addressing Refugee Child and Youth Health with Meza Saida. And coming up on Spark Conversations, our podcast series, we have Navigating the Child and Youth Mental Health Crisis, Challenges and Opportunities, which will launch on July 4th. And this will involve Dr. Javid Sakara in conversation with our podcast host, Dr. Catherine Smart. Stay tuned for more details on all of our Spark offerings. You can, it's great if you watch live, but if you don't, all our webinars are recorded and made available within a week after the fact on our webinar, on our website and on our YouTube account. Thanks again for joining us today. Thank you to Nikki, Raissa, and Vicki for this presentation, and hopefully we'll see many of you back here in a couple of weeks. Bye-bye, everyone.